Hello, my name is Emma, and I will be presenting an article titled Risks of Adverse Pregnancy Outcomes of Late and Postterm Pregnancies in Advanced Maternal Age, a National Cohort Study. This article is published in the Obstetric and Gynecology Journal.
The summary of the research problem for this study is advanced maternal age in the Netherlands has been increasing, and this study's intent was to gain more insight about the association between maternal age, gestational age, and adverse pregnancy outcomes. The sampling method used in this study: Dutch researchers used a research database called PARIND to gather data on births registered between 1999 to 2010 of women of advanced maternal age who had a singleton birth, no sign of any fetal abnormalities, were greater than 37 weeks gestation at birth, and this study excluded women with pre-existing hypertension or gestational diabetes history. The women chosen for this study received care prenatally all the way through 28 days after the baby was born. The study tool, called PARIND, is an anonymous study tool of real live births documented in the Netherlands. The study design. This study broke maternal age into categories, the first being of age 18 to 34, the second age 35 to 39, and the third category 40 years and greater. The study used those women of 18 to 34 years age as the reference group, and the other two groups were categorized as advanced maternal age. The study compared the reference group with advanced maternal age group with variables including adverse outcomes for baby and adverse outcomes for mother, each with subsets within those two groupings. Then the denominator was the number of live births. These comparisons were analyzed using risk ratios adjusting for factors such as gestational age, onset of labor, and parity. Study findings. The database consisted of 1,006,048,992 women with the desired requirements and exclusions mentioned beforehand, concluding that the women in their first pregnancy at an older gestational age are at higher risk for adverse maternal or neonatal outcomes despite age as a factor. They also discovered that women under the age of 40 have lower risk for adverse outcomes when labor is spontaneous rather than induced. The statistics, according to this cohort study, show that risk for adverse outcomes increase, especially for women above the age of 40. As for further research questions, this study states that there is not much data about pregnancies that are greater than 42 weeks, so they could not include information about association between gestational age and maternal age with adverse outcomes beyond their 41 weeks that they studied. They also included that there is more room for studying advanced maternal age older than 40 years in comparison with women aged 35 to 39.
I look forward to continuing to research advanced maternal age. Thank you for listening to this presentation, and I hope you have a great day.